Hello, today I want to talk about an important topic for healthcare providers in California. What exactly makes a service medically necessary when billing Medi-Cal? Medi-Cal, California's Medicaid program, only reimburses for services that meet the definition of medical necessity. If a service doesn't qualify as medically necessary, the claim can be denied, and in some cases, repeated improper billing can lead to audits, recoupments, or even fraud investigations. The term medical necessity implies that the treatment is needed by the patient. Conversely, if a treatment is not medically necessary, it implies that the doctor is providing unnecessary treatment. This is not true, and under Medi-Cal rules, the phrase only distinguishes between treatment that will be reimbursed and treatment that might be very important and helpful but is not covered by Medi-Cal. With this understanding, let's consider what medically necessary means for Medi-Cal billing. Generally, a service is considered medically necessary if it is reasonable and essential to 1. Protect the patient's life, or 2. Prevent significant illness or disability, or alleviate not just pain, but severe pain, or if the treatment helps the patient achieve, maintain, or regain functional capacity. For children under 21, the standard is even broader under the Early and Periodic Screening, Diagnostic, and Treatment (EPSDT) benefit. Services can be covered if they correct or improve a defect, physical or mental illness, or condition. Medi-Cal follows both federal Medicaid guidelines and state-specific rules. Providers must document why the service meets these criteria. Simply performing a procedure or test isn't enough. The medical record needs to clearly support the clinical justification. Common areas where medical necessity comes into play include the level of evaluation and management, EM services billed, diagnostic tests and imaging, treatments, therapies, and durable medical equipment, prescription drugs, and specialty procedures. To be reimbursed and to avoid accusations of overtreatment, accurate documentation is key. Your notes should show the patient's diagnosis, symptoms, history, and why the chosen service was appropriate at that time. Vague or templated notes can raise red flags during a review. Accuracy is key. A billing dispute can change into a criminal fraud case if the documentation is not just inadequate but inaccurate. Using templates to describe a condition risks an accusation of inaccurate record keeping because the medical chart is not individualized to the particular patient. If you're a physician, clinic, or billing professional working with Medi-Cal patients, understanding these medical necessity standards helps protect your practice from claim denials and compliance issues. Repeated rejections of bills, audits, demands for further information can be warning signs that you are under the microscope of a fraud investigation. If you have questions about a specific billing situation or need help defending against a Medi-Cal audit or overpayment demand, it's wise to consult an experienced healthcare attorney who understands California's Medi-Cal rules. Thank you for watching. If you are concerned about Medi-Cal billing compliance and physician defense matters, contact our office at 925-283-1863.